As spring is upon all of us, that pollen count will be as well, and it's increasing. And maybe you or somebody in your family has already felt the itchy eyes, runny nose, sneezing.
Perhaps so. Many of us have. But how can you know whether you have allergies or something more serious like COVID? The symptoms are similar. Fox 13's Spencer Joseph spoke with a healthcare expert about how to spot the difference.
It's the start of the dreaded allergy season, and with pollen counts picking up and sneezing and watery eyes on the horizon, the question many might think is it allergies or is it COVID?
This is a really important question.
Dr. Vento, infectious disease specialist with Intermountain Healthcare, talked us through some things you shouldn't see with allergies.
If you have muscle aches and often even diffuse muscle aches, that's not typically seen with allergies. Fever, you shouldn't see fever with allergies.
As for allergy-specific symptoms,
you do see sneezing very classically and very commonly with allergies.
So if somebody sneezes because of their seasonal allergies, and they happen to be asymptomatic for coronavirus, that's where there's a risk.
And what if you happen to have been infected by someone with COVID and you had no symptoms of COVID, but you happen to have your allergies? I personally, and I don't think many people, want to go walking around where other people are sneezing with no mask on and itchy, watery eyes, and then they tell you, oh, it's just allergies, don't worry. I'm not going to feel so good.
So while other illnesses might be down,
we haven't had flu, we haven't had the classic respiratory viruses.
Allergies are here to stay. So if you're unsure, especially if you've been exposed to the virus, best thing is to just get tested.
You know, we don't certainly have the level of COVID that we had 6 months ago, which is great, but it's still not gone. In that situation, I would not only tell folks that you might consider getting tested if you think you've had an exposure with or without symptoms.
Spencer Joseph, Fox 13 News, Utah.
Well, if you have an N95 mask or something similar, there is some good news if you also have allergies. Doctors say those masks can stop some pollen or allergens from entering your body. Well, pollen counts, take a look here. They're low overall today, but there are lots of things in the air like cottonwood, cedar, juniper, and mold.